Hello, I'm making this video for anyone out there who has a cat or cats with HCM or HOCM. Those are, both variations of the same heart disease. I want to offer a little disclaimer before I get started. And the disclaimer is not just any old disclaimer for the sake of having one. It's actually a very important and meaningful one. And it's just simply this, that whatever I say in this video is really about me sharing my own experience with my cat Ricochet and his heart disease, and some anomalies and twists and turns I dealt with during the process of learning how to care for him and interacting with the veterinarians and so forth. If somebody out there is hearing my experience and feels something that I say might be applicable to their own situation, it might be a good opportunity to go to their veterinarian, go to your veterinarian, and talk with them to find out what they would recommend in light of your interest in trying something new. What I'm trying to say is that regardless of what I say here, before you do anything with your cat and your situation, make sure that you discuss that with your veterinarian or your veterinary cardiologist. I also want to add, and this is obvious, I am not a veterinarian, I'm not a veterinary cardiologist, I'm just a lay person who's a pet owner, and I care about my pet cat Ricochet, and I went through a whole lot of things to learn how to care for him correctly as he goes through this heart disease, HOCM. That's the variation that he has, and I'll talk about that in a second. So the reason why I'm saying that is because all cats are different, and even with the same heart condition, different veterinarians and veterinary cardiologists may have different approaches. Also, the approaches taken by any given cardiologist may change over time, especially with all the advances in technology and so forth. So it's just always important to maintain good communication with your veterinarians regarding your situation. And this, I'm saying from firsthand experience, I've seen some videos out there for different subject matter, not necessarily heart disease, where some people are trying some things with their cat to help them with some condition. And I know firsthand from discussing with veterinarians, but also from reading online, that what those people are doing is not something they should be doing to treat their cat. There's stuff out there on YouTube and on the web and stuff that is going to be personal experience or anecdotal, experience, or maybe even something somebody's trying and they're not being smart about it. Beware of what you're taking in out there. I know that's a given for most folks, but I can't stress that enough. If you hear me say something in here that works for my cat, don't just assume it's okay to do that with your cat unless you discuss it with your veterinarian or your veterinary cardiologist. Okay, with that disclaimer out of the way, let's get on with the video. So my cat has HCM. Actually, he has HOCM, which is the same as HCM, but it's just a slight variation. So HCM, and this is a mouthful, so don't worry, it's not important, I think, to remember the name, but it stands for Hypertrophic Cardiomyopathy. And the HOCM is simply the same thing, but it's the obstructive variation or variant of HCM. So it's hypertrophic obstructive cardiomyopathy. Now, forgetting about all the words and terms and stuff like that, very simply speaking from my own layperson's perspective, and I'm not an expert in cardiology, but it is basically, HCM is a disease where the heart enlarges abnormally over time in a way that makes it more difficult for the heart to do its work to deliver blood effectively to the entire body and system of a cat. Human beings can have HCM as well, but we're not going to talk about any of that. I'm talking about just strictly feline and what I know about feline HCM. The obstructive variant, or HOCM, which my cat has, involves an anomaly in addition to the heart enlarging, as happens with HCM. There's a valve that occasionally kind of flaps over or in the way of the outflow valve, the outflow ventricle, or whatever you would call it. So it actually further restricts the outflow of blood. And it's just an extra anomaly that actually makes it a little more, from what I can tell as a layperson, a little more obstructive overall than just the heart thickening overall. So as far as I know, with HCM and HOCM, and I think heart disease in general, but I'm not a cardiologist, so I don't want to speak too broadly. I'm under the impression that at least for my cat's illness, there's really no cure. The only thing that can really be done is applying some kind of medical treatment like medications and stuff to help alleviate or mitigate the issues as the disease progresses. So one of the ways in combating this disease is to prescribe medications, as has been done for my cat, and within those medications are diuretics. From a layperson's perspective, the diuretics like spironolactone and Salix or furosemide, those are the diuretics, they have an attribute where they actually dehydrate the system to some degree. And my understanding is that dehydration of the system removes fluids from the system, and I think it alleviates or reduces the pressure and the amount of fluid that the heart has to deal with, which then makes it so the heart doesn't have to work as hard to do its job. Now, I may not be exact on that because I'm not an expert in it, but that's the gist that I understand right there. So the downside of diuretics is they dehydrate the system, and the way that they work in doing that is they work against the kidneys. So what you are doing is you're sort of, in a sense, I don't want to, this is going to sound a little harsh the way I put it, but you're sort of damaging the kidneys to help the heart. But it's not so drastic out of the gate. In other words, you're kind of putting some weight on the kidneys in order to help the heart. And one of the ways my veterinarian explained it is it's sort of like this balance, right? It's like this tug of war where you don't want to hurt the kidneys too much, but you got to put some extra weight on the kidneys, that not weight literally, but I mean metaphorically here. You got to put some burden on the kidneys by dehydrating the system in order to help the heart out. And it's this kind of tug of war as you move forward with this disease. So my cat was diagnosed with HOCM around April 2016. Later on that year, he went in for a dental cleaning. When he was recovering, he started panting, which means that, during the surgery from the fluids and the IV and stuff, there was some fluid that got into his lungs. I don't know all the details there and whatnot, but it's a risk. And he had some really bad teeth issues and gum issues, and it was like, it's one of these things where you don't really want to do the dental cleaning, but they had to pull some teeth because his gums were kind of diseased in there and stuff. And so we went, for it and did that, and there was the risk. And so he was panting when he was coming out of it. So basically, he recovered from that event. It was very scary, that event. But basically, we were able to use Salix and stuff, and the fluid got out of the lungs. He came home with me that night. I talked to the emergency center from home that night, who said, yeah, he's fine at home as long as he's not panting anymore. But if he starts panting, you can bring him in here, but there's no need to. So they were really good. So all the vets coordinated and stuff, and it kind of just worked out well in that way. So we got past that. We went into the cardiologist, who after that event saw that there was still some fluid and stuff in the lungs. And it was at that time that Ricochet, with his HOCM, was officially diagnosed as having entered the early stages of congestive heart failure. Now, when that news was delivered to me, it sort of was just not a good thing for me. I was just blah, But I was under a misimpression, because when they told me that he was diagnosed with congestive heart failure, I thought it was sort of like the end in all this. But it really isn't. Like, congestive heart failure can be something that's like sort of happening, but you might not even see it at first, which was the case with Ricochet. It wasn't really readily evident. It was something that the veterinary cardiologist had to diagnose. And I'll just say that, like, congestive heart failure, if you hear about the most dire circumstances of that with a cat, it really is like, it makes you think that congestive heart failure is always that bad, because the end scenarios are pretty bad, situations, and they're things you hope to avoid. But congestive heart failure is really just a generic term, as I understand it. Again, layperson, so talk to your vet to get clarifications. But my understanding is congestive heart failure is just a generic term that actually is used to indicate that the heart is unable to really supply blood effectively to the rest of the body to some degree. Usually it's associated with some sort of fluid entering into the lungs, I believe. I don't know if it definitively has to mean that, but I think it usually encompasses that to some degree. In any event, it's a veterinary cardiologist that will make the determination of whether your pet has entered into congestive heart failure or not. And I thought it was this big dire circumstances thing, and it turned out that I was totally wrong about that he had just entered a new phase of his disease, and that new phase was something that had to be managed a certain way, but we shouldn't make any assumptions about how long he has left. There are certain, rules around that and stuff, or I should say averages or whatever, but I wanted to know a little bit about that, but I also had a really good vet who was really positive about shooting for the moon while discussing typical realities. And so he was tempering things, but he was also very positive about, like, let's, don't get negative type of thing, and I love to see that in veterinarians, when they're upfront about what the prognosis is, but then they're really going to go for that best, shot. I think always shooting for the moon is great, and being realistic about typical prognoses. I think those are not mutually exclusive, and that's just my nature. So once Ricochet was diagnosed as having entered the early stages of congestive heart failure, they added new medications, and within those were the diuretics, and they were spironolactone as well as Salix. Salix is an alternative name for furosemide. How you doing there, bud? How's it going? You want to come here? Say hello? No? Okay, you can come here if you want. Oh, look at this good guy. This guy's a little buddy, Gotta try to take care of him, So things had been fine all the way through, to most of, I think, 2017. Somewhere in 2017, like within the last year or something like that. It's 2018 now, so sometime, within the last year or so, there was an event that occurred where Ricochet, sort of out of nowhere, kind of, I don't want to say collapsed, but he kind of went flat to the ground, like on all fours, in a way that I had not seen before. And he would let out this guttural yowl that is not normal for him, like great pain or something like that. And I was just really frightened when I first saw that happen. And when it happened, it's like when he got up and went away, I noticed that he had gone to the bathroom, and he had gone number 1 and number 2. So I was like, okay, well, what's going on? Did something scare him and he went to the bathroom, because that can happen, or what's going on? Well, anyway, it turns out that he was dealing with constipation. And I didn't really know that at first, and I talked with the vets, and they had mentioned, that possibility, but we were kind of uncertain. Now, I have to tell you, when this first happened, it was extremely terrifying to me because, and this is really important, when you have a cat that has a heart disease, and I've had 2 cats with heart disease, including Ricochet. I had another cat named Oakland who passed away from his heart disease. He had a very rare heart disease, a supravalvular mitral stenosis, I think. Supravalvular atrial mitral stenosis. Is a mouthful. But all these heart conditions, what they always tell you up front is what may possibly happen to your pet and things to look out for. And among those are symptoms that relate to a dislodged blood clot, because blood clotting is part of what can happen with a heart disease like this. And what can happen is a blood clot can become dislodged. What can happen is it can actually go and block something somewhere in their body. And typically, I believe what the vets have told me how this usually manifests, but it's not a hard and fast rule, is it may well manifest by the pet becoming paralyzed in the hind legs. And my understanding is this is not uncommon, this kind of result with dogs or cats and whatnot. So anyway, when I saw him go to the ground like that, I freaked out. I thought, this is that event, and oh no, and all this kind of stuff. And it turns out it was constipation. So that was good that it wasn't as bad as that bad case scenario, that worst case scenario kind of, but it still was like, well, what's this all about? So one of the times this constipation event occurred, he let out this like yowl or cry, and he peed. He did number 1, but there was no number 2, and he didn't seem to be doing well after that event. And then we went to the emergency room, and he had an enema, and a lot of stuff came out. So basically what I learned is that the diuretics that were prescribed to my cat, which cause that dehydration, which helps to alleviate the work that the heart needs to do, well, they dehydrate the system, and that affects the ability for the cat to process the bowel, because you need moisture there and all that kind of stuff for, things to function properly. So I had to find a way to deal with this situation. And I started, talking to my veterinarians as well as looking online. And my veterinarian said, it's okay to use Miralax, which is I think it's like a fiber additive or a laxative of some kind. And it actually has a fairly neutral taste and smell. So you can put it on foods. My cat actually does not mind it when it's on the food. He's able to eat his food with that. Now that alone did not solve things. And we had another recurrence of this where I had to go to the emergency room and they had to do another enema. And so I was kind of freaking out because those visits are expensive, and I'm between work right now, and I'm in the midst of a job search and stuff. And so I have to be smart about this and try to find a way to, solve this, and plus for his own comfort, I don't want him to start, yowling and feeling pain, to process stuff in that way. So I just, I need to help him too. So, I really wanted to find an answer here. So, well, hello. Hi, how's it going? This is my good guy again. Hello. How are you? Hello, bud. Every time, if I'm working here or even during, job interview things and stuff, this guy comes and visits me. I love it. I think it's great, he's just he's like, it's my keyboard. Oh, you're doing an interview? Who cares? No, he's very supportive. He's really, this guy, anyway, so I started talking with my veterinarians in detail about this, and my vet actually had a really good discussion with me, and she gave me a whole bunch of information about heart patients and diets. And she gave me some really key information which highlighted to me that one of the major components you want to rein in when your pet is dealing with constipation from heart disease and medications and all that kind of stuff is sodium. You want to reduce that sodium as much as possible without harming, the diet, the intake of food, And I say that because sodium is an additive that helps the taste of food, and that affects human beings, but it also affects pets as well. And I've learned this. I didn't really know that before. But apparently most of the over-the-counter pet foods, even high-quality kibble, for example, has particularly, high sodium content. I looked at the bare minimum required for daily allowance for a pet based on some organizations, kind of rating. And it's amazing to compare that with what you'll find in a high-quality kibble. So what I learned there is high-quality kibble or even wet food doesn't mean, low sodium, and it doesn't necessarily mean it's healthy or right for your pet. So I began by starting with a prescription diet through my veterinarian, a wet food diet. And beyond my cat licking a little bit of it initially and I had some luck with it, it really was not working. My cat was pretty much rejecting it. And he actually started losing weight. It actually, I thought, if I let him get hungry enough, he'll eat it. and that wasn't the case. So my cat had been eating high quality kibble, and I used to keep it in a gravity feeder like all the time, so he had it 24/7. And this stuff was particularly high in sodium content, and it was good quality kibble. I mean, for most cats, it would have been fine. So what I think my cat was doing is just overloading on this kibble 24/7, and that was fine before we went on the diuretics. But after the diuretics, it was a total mismatch. And it was not something I discovered until after he started struggling to go to the bathroom with the yowling and those events that I mentioned. And when trying the prescription diets that I initially tried, and his weight was, he was losing a little bit of weight and stuff, the cardiologist expressed some concern that the weight loss was not something, he wanted to see, and felt like in weighing all things, it'd be better to approach a more mild sodium reduction for the sake of letting him have something that he'll eat and getting that weight back up there. So within the information my cat's vet gave me to research diet options for my cat was a link to Vermont Veterinary Cardiology, which is a website that has some information on how to look for mild or moderate low sodium diets for a cardiac veterinary patient. I found this information particularly helpful. It really informed me as a pet owner how to research sodium content in pet food, both over-the-counter and prescription diet. It gave me information on how to calculate the amount of sodium per 100 kcal, for the right kind of diet, and I was looking for mild reduction at this point. Also, you can calculate it as a percentage of dry matter and figure out how much your cat is getting. Sometimes pet food labels won't have enough information for you to calculate the amount of sodium that you're feeding your cat. But I found that every food company that I contacted responded with enough information for me to calculate all that. Some of them even have it on their website if you go look, but if it's not there, they'll have a contact info and you can send an email to them or something. And all of these food companies, they responded pretty quickly with the information. I'll put a link below to the Vermont Veterinary Cardiology website so you can see the stuff that I use, the information. One thing I will say is out there in the internet sphere is I ran into a couple of lists that were very helpful that showed the amount of sodium content in various popular prescription and over-the-counter brands of food. But what I learned is I think some of those were created at a different point in time and are not necessarily current. And so I used those as a basis to kind of check some things and maybe as a clue of where to go check. But what I learned in this whole process is that it was really important for me to do calculations firsthand to really verify the sodium content myself. And then I used the scale, the levels in the Vermont Veterinary Cardiology website that show you different sodium levels of reduction, like mild reduction, moderate reduction, and so forth. And I was going for mild reduction, so I looked at what those figures were, and then I wanted to go find a cat food that had a reduction within that range. And if this doesn't make sense and you're interested in looking into this, if you go to that website and look at it, the math is fairly simple, so I found it pretty easy to grapple with. I did have to spend a little bit of a weekend, kind of diving into some of that and wrapping my head around it, but it's actually manageable if you get into that kind of stuff. So I was doing these sodium calculations and I was trying various different kinds of food that fell within the mild reduction, and I really just was not having a lot of luck. So I had been focused on getting my cat a wet food diet because it just sounded like the most optimum diet, likely because it is for a constipation patient in my cat's situation. I mean, you hear that a lot, try to get a wet food diet. So I was like, well, my cat loves kibble, generally speaking. Not all kibble, but when he finds a food he likes, it's usually kibble, not wet food. Wet food, he'll kind of nibble a little, but then he goes to the kibble. So I was really starting to think about my cat as an individual cat, right? Like my cat likes kibble a lot, that's my deck of cards with my cat. So I was thinking, what if I found a low sodium kibble that I could give to my cat. And I also wanted to try to find something that was economical that I could easily get at the pet store down the street. I wouldn't mind paying for a prescription diet if I could get one that was rock solid that my cat loved, but I wasn't having any luck there. I also wanted to find an answer immediately, in my local pet store's selection of food, because when you order prescription diet, usually you got to wait for it if it's not immediately available, and not all places carry all the kinds of prescription stuff, so you have to order online. So I started looking at what might be available that would be a dry kibble that has low sodium, and I started doing the calculations from that Vermont Veterinary Cardiology website on all the dry kibbles, and most of them were way up there in that high range that I was seeing. But then I stumbled across one that was kind of low, and it was a hairball control dry kibble. So when I saw the hairball control, I was thinking about how my cat likes these hairball treats. And there was nothing about that connection that was going to guarantee me that he was going to like this kibble, but I know that hairball remedies very often have a laxative quality to them, and I thought, well, what if this dry kibble, which has a mild reduction in sodium, also has some kind of laxative quality, maybe some fiber in there or something mixed in with the protein and whatnot. So I went down to the local pet store and I bought a bag of this stuff and I brought it home, and my cat was, gaga over it. I mean, he just loves it. And he's getting that all the time. And I'm feeding it to him every day, and I'm giving it to him in a portioned amount in a small bowl. There's no more 24/7 gravity feeder, but he rarely finishes that bowl in one day. But it just allows me to monitor how much he's eating of that. Now, there's another benefit to this kibble. I don't know if you've ever seen kibble that cats have, but kibble very often has some kind of subtle moisture or oil quality to it. If you feel it enough or touch it enough, it's not usually noticeable, but this particular kibble had, a nice, fresh sort of, oily quality to it. So what I did is I sprinkled some Miralax on it, and that's the stuff that the vet recommends. I put like 1/8 of a teaspoon in the morning or in the evening. They gave me a limitation per day, but we're well under that limitation. So I sprinkle like 1/8 of a teaspoon on top of this kibble that I found, and the oil quality on that kibble retains or it creates a situation where the Miralax sticks to the kibble pretty well, not solidly though, so it's like a little bit gets on each piece, and I mix up the kibble after I do that. And what this does is it gives him a hairball control dry kibble that he loves with the Miralax on top, and it's been working fantastically. Now, I will say there's a little thing I've been adding to this that I'm not sure is required or not, but I've been doing it and it has been working as part of the overall formula or approach that I've been taking with my cat. And that is, I researched a little bit about Miralax. Now, my understanding with Miralax is that it's not really going to be helpful unless there's some water present. So if a cat is eating dry kibble but is relatively dehydrated, I was thinking it may not be as effective if he doesn't drink water immediately after. So what I do once in a while is I have a little syringe that has no needle on it. It's just like a kind of a fat syringe, and I can put some water in there, like 3 cc's or 5 cc's of water. And what I do is he lies down on his side, and he's very cooperative, so this may not work with any other cat or whatever, but it works with my cat, and he lies on his side, and I can put the syringe right on his lip on the side and just drain some water there, and he laps it up.
That's a good guy. That's a good guy. We're just going to do a little bit of water here. Good guy. Good guy. Good guy. Very good. Very good. Very good.
and I always say to him, really good, good guy, good boy. My cat really responds to positive reinforcement very nicely, and so I just try to use that as a way of letting him know that it's really good when he laps up that water there. And it's never, there's nothing ever wrong even if he doesn't though, too. Now, that water thing, I just do that as like a spot check type thing. Like I do that once in a while. Like if I'm home in the evening, I may do it. But I don't know if it's required. And he does drink water. I see him drink water after he eats sometimes, not all the time. So if I happen to be home and I haven't seen him drink water for a while, I may give him a little bit of that on his lip and see if he laps it up. And if he does, then it's good. You know, he takes in some water. Now, what I will say is he has been having really wonderful number 1, number 2 events, and I don't mean to share that with you in some sort of, you know, way that I'm sure you're really joyous now that I've shared that, but the point is it was fantastic from a parent's perspective. I felt like I was a parent potty training my kid because I was just head over heels when I first saw him, you know, kind of come back in that way and function properly. I will say though, I mean, he really has been eating quite a bit of food, and you know, it's been passing perfectly fine going through his system. I will say he's been eating quite a bit of food. I think he's starting to gain some really good weight back there, and the food kind of goes through his system really nicely, and I'm just really, really extremely grateful and happy. Also, and this is going to sound kind of corny, but my cat, since he responds to positive reinforcement really nicely, if he goes in the litter box and I see that he goes number 2 over there in the litter box, I will wait till he's finished. I know he's doing it, and I'll just like not bother him. But then when he's finished, while he's scooping to cover everything, I will go over there and say, good guy, very good. And, you know, it's kind of, you know, like I sort of feel like, again, it's that analogy like potty training. In my own strange way, I sort of feel that if I give him positive reinforcement there and also positive reinforcement with the water, I don't know, but maybe somewhere in his mind, there will be this connection, and he'll understand the water to going there kind of connection. And he knows like, oh, that's always a good thing if you go and do that. And it's always a good thing if you drink water. And I feel I've been noticing an uptick in his natural water drinking, and he goes to the litter box and he does that. And it's just like, I've been seeing a really good improvement in things. So this is great that I got past all that diet stuff. That was a huge like tongue twister, anomaly, Mensa question 10 times over type thing for me. I mean, it was just like a lot of things to navigate. One thing I wanted to mention about this journey with my cat's heart condition is that he was diagnosed, I believe it was sometime last year, with a blood clot, and it was not immediately catastrophic, but it represented a huge risk should something break away and lodge somewhere in his body that could cause a really bad problem. And so the veterinary cardiologist prescribed a medication to help break down that blood clot little by little over time, and we ended up seeing some positive results from that with the blood clot shrinking. So after we solved this anomaly with the diuretics causing the constipation, I have to tell you, I was really surprised some number of days after solving all this, as his system was getting back going and everything, he became so extremely playful, like just jumping up like he used to jump up. I was really surprised, you know. And he was jumping all around and playing and just really asking me to play, and he still does. And it's like a night and day difference. Anyway, thank you for watching this video. If you like this video or found it helpful, please do click the like button. If you think somebody else may, you know, be able to benefit from this information or whatnot, feel free to forward this video or click the share button to share it. And if you want to subscribe to the channel, there's a subscribe button there, and I think it appears also in the video here. So that's it for now. Thank you very much for watching, and have a wonderful week or weekend or whatever it may be. Enjoy your summer, and take care. Come on back again to see some of the other videos. All right, thanks. Bye.